cytology, but I will say a few words about it now. You know that the bones are part of the musculoskeletal system. They are connected by joints and form the passive part of this system. The human body is made up of 206 bones. We have two parts of the skeleton, axial skeleton and appendicular skeleton, such as the upper and lower limbs. What's the function of the skeletal system? Of course, support and movement, the protection of the internal organs, mineral homeostasis, hemopoiesis, and triglyceride storage. We have two types of bone tissue, cortical bone, or another name is compact bone. Of course, the layers are periosteum, intercortical area, and endosteum. I forget to tell you that if you want, I can give you this presentation before the colloquium, so don't worry about it. The second type is cancellous bone or spongy bone. Here on the right side of the screen, you can see a long bone with its structure. Here we have cartilage for the joints. This one here is epiphysis from the two ends of the bone. Between the two epiphyses is located the diaphysis. Another picture, of course. Epiphysis on the two ends, diaphysis, and between the diaphysis and epiphysis is located metaphysis. Of course, the bones has blood supply, but on the next slide you see it. According to their shape, the bones are long bones. For example, humeral bone, the humerus, radial bone, tibia, and femoral bone. Short bones. For example, the bones in the hands and tarsal bones in the feet. The flat bones. On examples, for example, the skull, ribs, scapula. We have irregular bones. For example, the vertebrae and the bones of the pelvis. Sesamoid bones, which are small. For example, is the patella. They are developing the tendons. According to some authors, we have pneumatic bones, which contain air-filled cavities covered by mucosal membrane. For example, ethmoid bone, frontal and maxillary bones. Of course, blood supply. We have one nutrition artery, and of course, the periosteal arteries, epiphyseal arteries, and metaphyseal arteries. On the next slide is the growth of the bone tissue, which is a note for this semester and for my lessons, but you can read it if you have free time. And let's start with the spine, or in Latin, columna vertebralis. The spine is made up of 33 vertebrae. It consists of different regions. From C1 to C7 is cervical region. We have 7 vertebrae here. From T1 or TH1 to TH12 is the thoracic region, 12 thoracic vertebrae. The next region is lumbar, from L1 to L5, and we have sacral from 5 vertebrae and coccygeal, most often 4. And the vertebrae of the sacral and the coccygeal regions have fused and formed 2 separate bones, the sacrum and the coccyx. Can you see my mouse? Or no?
Yeah, we can see it.
Okay, perfect. So I tell you that the vertebra is an irregular bone. Each vertebra has a body or corpus vertebrae and a posterior vertebral arch, arcus vertebrae. It also has processes, which are 7. The vertebral arch is formed by pedicles and laminae. The 2 pedicles, in Latin pedicus arcus vertebrae, extend from the sides of the vertebral body to join the body to the arch. From each pedicle, a lamina projects backward and medially to join the vertebral arch and form the posterior border of the vertebral foramen. You can see here. That's the vertebral body. Here is the 2 pedicles. This is the lamina. And they form vertebral foramen. We have also vertebral notches. We have superior and inferior. And the notches of 2 adjacent vertebrae form the opening of the intervertebral foramen, where exit the spinal nerves. Here. We will see it on the next slide. I told you that the arch and the body, the arch, this is the arch, that's the body. They form the spinal foramen or foramen vertebrale. And these openings in all the vertebrae form the spinal canal, which contains, of course, the spinal cord, spinal roots, and dorsal root ganglia. We have 7 processes projecting from the vertebra. We have 1 spinous process, or processus spinosus, 2 transverse processes, in red here, and 4 articular processes, 2 upper and 2 lower. Here is the superior articular process, here is the inferior. You can see here. For example, this is a cervical vertebra, this is the thoracic, and this is the lumbar. Here is the spinous process, the vertebral arch, and the body. And between the body and the vertebral arch is vertebral foramen. That's the lamina here, the 2 pedicles. And of course, here should be superior articular process with a facet for the joint. What else? Here, on the lateral view, you can see superior vertebral notch and the inferior vertebral notch. And I told you that the notches of 2 adjacent vertebrae form intervertebral foramen. Here is the superior notch, here is the inferior, and that's the intervertebral foramen. That's the sacrum. We'll talk about each bone on the next slide. Let's start with cervical vertebrae, from C1 to C7. The first, second, and 7th vertebrae are, I can say, extraordinary. But the common for the vertebra, for the cervical vertebrae, is the transverse foramen here, which is located on the transverse processes. In this foramen, we can find the vertebral artery. You can see this foramen only in the cervical vertebrae. That's the difference between the cervical region and the other of the spine. The name of the C1 is atlas. This is C2, which is called axis. And the other don't have names. For C7, specifically for C7, is that its spinous process is long. Where's my mouse? The spinous process is long and bifurcated, and we can palpate it from the skin surface. It is called vertebra prominens because of its spinous process. And another specific thing is that the anterior tubercle of the C6 is called tuberculum caroticum, because it separates the carotid artery from the vertebral artery. If you have questions, you can ask, don't worry. Let's start with C1. I told you that each vertebra has body, but the atlas doesn't have. Here we have only anterior arch, posterior arch, and two lateral masses, massa lateralis. On the anterior arch, on the outer surface of the anterior arch, we have anterior tubercle, tuberculum anterius, and on the posterior side of the anterior arch, we have an articular surface for the dens of the axis, C2. So that's articular surface. The anterior arch is shorter than the posterior. So anterior arch, on the outer surface we have anterior tubercle. On the inner surface or on the posterior side, we have articular surface for C2. What else? I told you we have posterior arch. It's the same. On the outer surface, we have posterior tubercle. And here on the superior or upper surface of this arch, we have a groove called sulcus arteriae vertebralis. Here we can find arteria vertebralis, the vertebral artery. This is massa lateralis here. With two articular facets, a superior. Where is my mouse? No. Here is the superior articular facet. And of course, we have inferior. The superior articulars with the condyle of the occipital bone, and the inferior faces for C2. We have transverse processes here, and of course with foramen transversarium, transverse foramen. Do you understand? Do you hear me?
You are now unmuted.
Yes.
Okay. Is it
You are
clear?
now muted. You are now unmuted. You are now muted.
Yes.
Okay. So, again, that's the atlas. Here is not like that. Here. Again, anterior tubercle, anterior arch, fovea dentis, the articular surface for the C2. Here is facies articularis inferior. Here is superior. Massa lateralis, of course, here and here. The posterior arch, transverse process with transverse foramens. Here is the same. On the posterior arch, we have posterior tubercle. On the anterior arch, we have anterior tubercle with fovea dentis on the inner surface. The lateral masses, vertebral foramen between the two arches and the lateral masses, transverse process with transverse foramen. So C1 doesn't have body and spinous process. Again, you can see here, this is the odontoid process of C2. This is the anterior arch of C1 with articular surface for the dens axis. Here is fovea dentis, and that's the joint between them. You can see posterior arch with posterior tubercle. This one should be superior articular facet for the condyle of the occipital bone. Transverse processes here, and here we can see transverse foramen, small part of it. Okay, the next one, C2. It is called axis. It has body, which continues upwards in a tooth or dens axis. This one, that's the superior view. This is the dens axis. Here is the body. We have also anterior arch, this one and this one. Of course, this is the vertebral arch. Here we have spinous process, which is bifurcated, and transverse process with transverse foramen. Again, here we can see the two pedicles, left and right, and lamina arcus vertebrae, again, left and right. What else? Again, we have superior and inferior articular surfaces for the connection with the C1 and C3. That's the anterior view, dens axis, the body, or in Latin corpus vertebrae. Here is processus transversus. Of course, on the dens axis, we have articular surface. We have apex dentis and processus articularis superior with articular surface, I told you. The lateral view, again, the body, dens axis with its apex and anterior articular surface. This is the posterior articular surface. Spinous process, which is bifurcated, and lamina arcus vertebrae. This is the inferior articular surface for C3. You can see here the atlas with the axis. Here's the joint between them. Dens axis with the articular surface of the atlas, which is called fovea dentis, on the inner surface of the anterior arch. Questions?
No.
Okay. So let's continue with the thoracic vertebrae. There are 12, from TH1 to TH12. So here we have, again, body, spinous process, transverse processes without transverse foramen. You can see only transverse process without the foramen. And of course, we have articular surfaces for articulation with the heads of the ribs, which is called fovea costalis. Wait a minute, maybe on the other side. Yeah. Here you can see fovea costalis for the ribs. We have fovea costalis superior and inferior for the ribs, for the heads of the ribs, and of course, fovea costalis of the transverse processes for the tubercles of the ribs. The first thoracic vertebrae has an entire articular facet for the head of the first rib, and a semifacet for the upper half of the head of the second rib. So spinous process, vertebral foramen, superior articular facet, of course, for the C7, the body of the vertebra. Here is the superior costal facets. This is the superior, this is the inferior. Of course, the vertebral notches, superior and inferior. This should be the spinous process. So here, the superior and the inferior fovea costalis is for the head of the rib. Here on the transverse process, fovea costalis processi transversi is for the rib tubercle. You can see here, that's the head of the rib, that's the tubercle of the rib. The head of the rib articulates with the body, the tubercle articulates with the transverse process. Again, the vertebral body, spinous process, transverse process. Here we have superior and inferior, which we can't see on this picture, for the head of the rib. And here we have fovea costalis, the transverse process for the rib tubercle. The same thing. Here is inferior vertebral notch on the TH6. This is TH7. Here should be, but we can't see it, the superior vertebral notch. Here is the inferior of TH6. Here is the superior of TH7, and between them is foramen intervertebrale. That's the rib. Here is the head. That's the tubercle. Half part of the head articulates with the articular surface of TH6, the other half part with the superior articular surface of the TH7. So one rib head articulates with two adjacent vertebrae. And of course, the transverse process and with its articular surface for the tubercle. So what's the difference between the cervical and the thoracic vertebrae? The cervical vertebrae have the transverse foramen. C1 is called atlas, C2 is called axis, while the thoracic vertebrae have articular surfaces for the ribs, for the head of the ribs, and for the tubercle. For the head is on the body, for the tubercle is on the transverse process. Lumbar vertebrae. There are 5, from L1 to L5. So each lumbar vertebra has body, again, which is large, and a vertebral arch. Again, we have 2 pedicles, left and right, 2 laminae, again, left and right, which encloses the vertebral foramen. And again, 7 processes. We have 1 spinous process, 2 transverse processes, processus costalis, which here we can see where maybe here, mammillary. Yeah, here we have accessory processes, this one and this one, and mammillary processes here and here. So 3 tubercles can be noticed in a transverse process of a lower lumbar vertebrae. The lateral are called costiform processes or processus costalis. The mammillary process, processus mammillaris, and the accessory process, processus accessorius. The L5 has the tallest and thickest costiform process. Here is maybe L3, for example. That's the body, 2 pedicles, laminae, spinal canal, or vertebral, transverse process, articular process is this one here. What we can see also here, the inferior vertebral notch, the superior vertebral notch, superior articular process, transverse process, spinous process, and inferior articular process. And of course, all of them have articular surfaces. And you can see here, from L1 to L5, that's the body. Between the bodies of the vertebrae is located the intervertebral disc. This is the inferior vertebral notch of L1. That's the superior vertebral notch of L2. And between them is foramen intervertebrale. These are the spinous processes. Of course, the transverse process, mammillary process, and superior articular process. That's the inferior. And we have joints between them, between the superior and the inferior articular processes. You can see here, spinous process, inferior articular, this one, and this is the superior, with the articular surface for the other, the adjacent articular process. Again, do you want me to tell you again these things?
Professor?
Hmm?
Do we have to memorize all of this?
I tell you the main things.
Yes.
So yeah, you should know the difference between the cervical, thoracic, and lumbar vertebrae. I told you, for example, For the cervical vertebrae, you should know that there is a transverse foramen on the transverse processes. For the thoracic vertebrae, you have to know that here we have costal surfaces, articular surfaces for the head of the ribs here. And we have articular surface on the transverse process for the rib tubercle. That's the main thing. And for the lumbar vertebrae, you should know that we have three another processes: costalis, mammularis, and accessorius. You can see it here. Superior articular, inferior articular, the joint between them. This is the mammillary process. That's the transverse, of course, and that's the spinal process.
So you have to know like the whatever distinguishes each vertebrae, not like everything completely.
Yeah, you have to make a difference between them.
Yes, okay. Thank you.
And I hope that you'll see the next tour after 2 weeks, so you can see these things in the department of the anatomy.
Okay.
So don't worry, we have time.
Yeah, okay, thank you.
Don't worry. This is new thing for me. I don't show you the real bones, so I'm so sorry, but we have time for revision. So let's continue with the sacrum. The sacrum is a large triangular bone which forms by the fusing of the sacral vertebra from C1 to from S1 to S5. You can see large triangular bone. Of course, we have base, an apex, and three surfaces: pelvic, dorsal, and lateral. So here is the base of the sacrum. Here is the apex. This one is the anterior view. So this is the pelvic surface. This is the posterior view. So that's the posterior or dorsal surface. And on both sides are the lateral surfaces. What else? On either side of the base, there is a large projection known as wings or ala ossis sacri, which articulate with the sacroiliac joints. In the middle of the base is a large articular surface. This one here is the articular surface for L5. Above it, here is L5. So it's the same for the apex. We have articular surface for the first coccygeal vertebra, CO1. What else? These things you can read it alone. So I want to tell you the main things now. For example, I told you that's the body with the base, basis ossis sacri, the apex here. Here should be L5. So that's the articular surface for L5. I told you that on both sides of the basis we have ala ossis sacri or wings. And of course, the pelvic surface, which is anterior, the dorsal surface, and we have two lateral surfaces. Okay, let's start with the pelvic surface or anterior. Here you can see 4 sacral foramina. Foramina, in Latin, called foramina sacralia anteriora. So they give exit to the sacral nerves. That's for the last semester, not now. I just tell you some additional information. On the dorsal surface, we have the same 4 openings, but they are called foramina sacralia posterior, or posterior sacral foramen. What else? Here we can see transverse lines between the S1, S2, S3, S4. That's the places of the fusion of these vertebrae. So, for the pelvic surface, you have to know the anterior sacral foramen and the transverse lines. The ala of the sacri, left and right, the base of the sacrum, and the apex. For the posterior surface, we have 3 vertical lines. One just on the middle, and another 2. So I told you that we have vertebral canal, which continues into sacral canal. So in the sacrum, we have sacral canal, with it ends, which is called hiatus sacralis, or sacral hiatus. Here on the posterior surface, just on the middle, we have median sacral crest. These are the spinous processes, the fusion of the spinous processes of the sacral vertebrae. Crista sacralis mediana. Laterally to it, we have second vertical line, which is called crista sacralis medialis. So this is the median, this is the medial. And the most laterally is crista sacralis, this one here, and here, crista sacralis lateralis. Sacral tuberosity, and of course, on the lateral surface, here, we have an articular surface to join the iliac bone. Here are all these things. Sacral canal with its opening hiatus sacralis, facies pelvica or anterior surface with the transverse lines, with the foramina sacralia anteriora, the dorsal surface with foramina sacralia posteriora, crista sacralis mediana, both the 2 crista sacralis medialis and crista sacralis lateralis. On the lateral surface, we have an auricular surface, facies auricularis, for articulation with the iliac bone, and the sacral tuberosity for the attachment of some ligament. You can see here. Again, sacral canal, its lower opening is hiatus sacralis. Here, that's the posterior view, that's the anterior view. From the posterior view, we can see crista sacralis mediana, just on the middle. Crista sacralis mediana on both sides of it, this one and this one. And the most laterally, crista sacralis lateralis, here and here. Of course, the posterior sacral foramina. And this is the auricular surface for articulation with the iliac bone. Here we have superior articular process, here and here, which is for the L5. That's the apex, here is the base, here, that's the anterior view, the base of the sacrum. The anterior edge of the base is called promontorium.
Professor? Is the sacral canal hollow, or is there like blood or vessels inside?
No. In the sacral canal, we have the filaments from the spinal cord. So spinal cord ends at level of L2, but we have cauda equina and terminal filaments here to S2.
Okay, thank you.
Don't worry, no problem. So the anterior edge of the base is called promontorium. It's the border between, you will learn this thing the last 2 weeks of this semester when we talk about joints. So the promontorium is the line between the major and the small pelvic cavity part of the line which divides them. So base of the sacrum, these are the lateral parts or the wings, ala ossis sacri. Here are the transverse lines between S1 to S5, the apex of the sacrum, and the anterior sacral foramen. That's the superior view. You can see here, again, the base, the two wings, superior articular processes for L5, and crista sacralis mediana. And if you imagine that here is the body, and these are the vertebral arch, here should be the sacral canal. It's the same like the vertebral canal. That's why this is the continuation of it. But here we don't have spinal cord. Sorry. Here we don't have spinal cord, only the terminal filaments. Lateral view. I told you we have auricular surface. It's like an ear, which articulates with the same surface of the iliac bone. It's called the sacroiliac joint between the sacrum and the ilium. Okay, that's it for the sacrum. Those are three surfaces: anterior, dorsal, lateral. You should know the base, the apex, the two wings, the foramens, anterior and posterior. From the posterior side, we have 5 crests. One crista sacralis mediana, just on the middle. On both sides of it, we have crista sacralis medialis and crista sacralis lateralis, here and here. Okay. Coccyx, or os coccygeum in the Latin. It's also called the tailbone. It's the final segment of the vertebral column. Again, it's formed by the fusion of 3 to 5 coccygeal vertebrae and is attached to the sacrum by a joint, sacrococcygeal symphysis. So, here we have 4 coccygeal vertebrae. They may be 3, 4, 5. It's different. Here we have transverse processes on CO1. That's the apex. Here we can see the 2 horns from the CO1. They are called coccygeal cornu. This is from the posterior. This is from the anterior. That's it for the spine. Do you want again? We have enough time.
Professor,
Hmm?
the tailbone, it's different for each gender, right?
Yeah. Also, the tailbone may be formed by separate vertebrae, not the fusion of them.
Like,
Also, the number of the vertebrae can be different in different people.
oh, okay.
That's why it's most often by 4 vertebrae, but they can be from 3 to 5.
Yes, okay.
Also, the CO1 can be separate from the other vertebrae. It's different.
But this is the most common.
There are many variations of this bone.
Oh, so
What?
there is this like the most common one here?
The most common, yeah.
Okay.
4 vertebrae which are fused. That's the most common.
Okay, thank you.
So let's start again from C1. So the first slide for the spine is for common information for each vertebra. So each vertebra has body, 7 processes, and an arch. But here, C1, I told you, C1 doesn't have body, doesn't have spinous process. It has only posterior arch, anterior arch, and the 2 lateral masses. So the anterior arch, which is shorter than the posterior, on the outer surface of the anterior arch, we have anterior tubercle. On the posterior side, here or here, is fover dentis for the dens axis. What else? On the posterior right arch, we have posterior tubercle, and of course, on the superior surface of the posterior arch, we have a groove for the vertebral artery, sulcus arteriae vertebralis. All these parts, the anterior tubercle, posterior tubercle, some articular surfaces, and etc., are for the origins or the insertions of the muscles, of different muscles, which you will learn about them next semester. So for now, you have to know the different parts of the bones. And for example, the last semester, you will study about the vertebral artery, and also the next semester, actually, you will study about the vertebral artery, its origin, its pathway. And if you know from this semester that here on the cervical vertebra, we have transverse processes with foramen transversarium, the transverse foramen, you already know that here is arteria vertebralis. And you will know the pathway of this artery. So, again, the anterior arch, the posterior arch, anterior tubercle, and the same on the posterior side, posterior tubercle, fover dentis of the inner surface of the anterior arch, lateral masses, left and right, and of course we have inferior and superior here articular surfaces. The superior ones is connected to the occipital bone. The inferior are connected with the C2, the axis.
Professor?
Hmm?
Does the C1 atlas vertebrae have a spinous process
No, C1 doesn't have spinous process.
and doesn't have body?
Doesn't have body and doesn't have spinous process.
Okay.
Only the anterior, the posterior arch, and the two lateral masses. And of course, transverse processes, left and right. Anterior arch, posterior arch, lateral masses, left and right, and two transverse processes. And the specific thing is this transverse foramen for the vertebral artery. You can see here the C2 again, odontoid process or dense axis. That's the body of the C2. So C2 has body and the spinous process, which is bifurcated here. You can see here too. This is the spinous process, lamina arcus vertebrae, the transverse process, which is here with transverse foramen. Of course, superior articular surfaces for the C1. Here, again, from the anterior view, that's the articular surface for fovea dentis of the atlas. Here, that's the body. Its continuation upwards is the dense axis. Here we have apex of the dense axis. These are the articular surfaces for C1, the superior articular surfaces for C1, the inferior articular surfaces for C3, sorry, here and here. This is the transverse process with foramen transversarium again. Lamina arcus vertebrae. That's the arch with lamina arcus vertebrae here. And below the arch and the body is foramen vertebral. Here we have spinal cord. Spinal cord, dorsal root ganglia, spinal nerves, of course, to the level of L2 in adults. In children, maybe to L3. What's the specific things for the thoracic vertebrae? Here we have body, which is larger than the body of the cervical vertebrae. Corpus vertebrae or vertebral body. Again, we have an arch with lamina arcus vertebrae. The spinous process here. Of course, the transverse processes without transverse foramen. On the transverse process, we have articular surface for the rib, for the tubercle of the rib. Here, fovea costalis of the transverse process, here and here. On the body, we have superior and inferior articular surface for the head of the rib. And if you see here, that's the head of the rib with two parts, superior and inferior. Here is the inferior articular surface from TH6, inferior costal surface articular. Here is the superior of the lower vertebra, TH7. So the rib head articulates with two adjacent vertebrae. Do you understand?
Yes.
Okay. But I told you that the first thoracic vertebra has one complete here. The first thoracic vertebra has one complete articular surface for the head of the first rib and one semi-facet for the upper half of the head of the second rib. So, for example, wait a minute. Not here. Maybe, no. I can't see. Oh, you can see here. That's the first rib. And you can see that it is connected only with the first thoracic vertebra. And that's the second rib, which is connected to the first thoracic and the second thoracic vertebra. And the third rib with the second and the third, the fourth rib with the third and fourth, the fifth rib between 4 and 5, and etc. You can imagine. Maybe if you are easier for you, this is one rib, for example, the fourth rib. That's the head with the superior and inferior articular surface. And here is the tubercle of the rib with articular surface for the transverse process. And you can see here again, that's the head with the body, or here is the rib tubercle for the transverse process. Here is the body, again, the vertebral arch. This is the two pedicles of the vertebra. This lamina arcus vertebrae. Here are the transverse processes and the spinous process of the thoracic vertebra. Between the arch and the body is vertebral foramen. What else? For the lumbar, of course, the body of the vertebra increases in size from up to down. So the lumbar vertebra have the largest bodies. That's the body. Again, the two pedicles and the spinous process. Transverse process with three parts or three tubercles, for example. Here you can see transverse process with the two articular processes, superior, here, superior and inferior, and between them, that's the superior articular process of L4, that's the inferior articular process of L3, and they form a joint. Next to it is the mammillary process. So left and right. And here is accessory process, most laterally. Articular processes, superior and inferior mammillary process, accessory process. And they are located on the transverse process. Here is spinous process. What was that here? This one here on L1 and this one here on L2. Do you remember? Two notches. We have one inferior on L1, for example, that's the superior one, that's the inferior one, that's the superior notch of L2, and they form what? Incisura vertebralis inferior is this one of L1, incisura vertebralis superior of L2, and between them is intervertebral foramen. Through this foramen pass the spinal nerves. And here is located the dorsal root ganglia. You study about that the next semester. So, the vertebral notch superior, inferior. Between the two adjacent vertebrae, we have intervertebral foramen. And here is the intervertebral disc. The discs are located between the body of the vertebrae. It's not for this semester, but you can see we have two parts. One nucleus pulposus in the center, and around it we have annulus fibrosus. That's for the, I don't know, maybe for the last few lessons of this semester. Again, this is the vertebral body, vertebral foramen between the body and the arch, transverse processes with accessory process, mammillary process, and articular process. That's the superior view, so that's the superior articular process. And spinous process. Pediculus arcus vertebrae, here is lamina arcus vertebrae. But they form the vertebral arch. For the sacrum, what we have here, I told you that the promontorium marks part of the border of the pelvic inlet, articulates with the last lumbar vertebra, so L5. So that's the anterior view, that's the posterior view. We have some parts here, the base of the sacrum, which articulates with L5, the apex of the sacrum, which articulates with the first coccygeal vertebra, CO1. On the anterior surface, you can see the transverse lines between the bodies of the vertebrae here from S1 to S5. Also, you should know these openings, sacral foramen. These ones are anterior. Of course, the wings, ala ossis sacri, here and here. What else? I told you that the sacral canal is a continuation of the vertebral canal. Its lower opening is called hiatus sacralis. From the lateral view, we have lateral surface also with auricular surface here for articulation with the ilium. And the joint between them is called sacroiliac joint. So here you can see L5. After that we have intervertebral disc, and this is the base of the sacrum. The anterior edge or the anterior margin is called promontorium. That's the anterior or pelvic surface. So here should be the transverse lines, the anterior sacral foramina, this one here, these are the wings, ala ossis sacri, and that's from the anterior side, from the anterior view. You can see here, this should be the spinous processes which are fused and form crista sacralis mediana. Hiatus sacralis you can see here, which is the opening of the sacral canal. Superior articular facet, which are for the L5. And the dorsal sacral foramina. From the posterior. After I told you about the coccyx, we have again base, which is connected to the S5 or the apex of the sacrum. And we have apex also here. The vertebrae are mainly 4. Most often 4, from CO1 to CO4. We have 2 horns, 2 coccygeal horns here, and in some people, or it's variation, we can see the transverse processes of CO1 here. That's the anterior surface, of course. Again, here we have transverse lines between the bodies, and that's the posterior surface. It's rudimentary organ, the coccyx. Okay, do you want to try to tell me some parts here? For example, what? For example, here, this picture, C. What type of the vertebra is this one? Cervical, thoracic, lumbar, sacral? What do you think? This one here.
Cervical?
C.
C,
This
C
one
or
here.
A? This is A or no,
This is C.
Okay.
No, I ask you to tell me what's the type of this vertebra here. Do you see my mouse?
Yes.
So, how do you think?
Cervical,
Why?
because it has a body, so it's not gonna be like C1.
Okay.
It has the transverse process.
But do you see a transverse foramen here?
No,
No. So, it's not cervical?
it's thoracic.
Thoracic. Why? How do
Sorry.
you think? You can, don't worry. I want to speak. So, how do you think why this vertebra is thoracic? Because here you can see
It has the facets on the sides
Yeah.
of the bodies.
Yeah, we have here on the both sides of the body, we have superior and inferior costal facets. And here on the transverse process, we also have the same facet. Here should be the head of the rib. Here should be the rib tubercle.
Oh yeah, because they connect to the ribs.
Yeah, that's why this is thoracic vertebra. And the body is bigger than the cervical, but it's smaller than the lumbar. So the E is lumbar vertebra. So A and B are cervical. This is the superior view. Here on this side are the lateral view. The A is cervical, C is thoracic, and the next one, or the last one, is lumbar. So here is cervical vertebra, but how do you think? This is C1, C2, or another from C3 to C7?
It's not C1 or C2. It's the others.
Okay, the others. Perfect. Why? We have here body.
Because the spinous process is not pointing downwards, upwards.
Okay. You can say also that here we have body and spinous process. That's why it's not C1, because C1 doesn't have spinous process.
Yeah.
And it is not C2 because it doesn't have Benz axis, right?
Yes.
That's why it's C3, C4, C5, C6, but it's not C7 because C7 has long spinous process, which is not bifurcated. While here you can see the bifurcation of the spinous process. So this vertebra is C3, C4, C5, or C6. So this is the spinous process. And what's the name of all this here? That's the lamina, that's the two pedicles, and all these things is?
The foramen?
Yeah, this is the vertebral foramen, but here this one is vertebral arch.
The arch, yes.
So the lamina and the pedicle form the vertebral arch. That's why the lamina is called lamina arcus vertebrae, and the pedicle is called in Latin pediculus arcus vertebrae, and they form the vertebral arch.
Do we have to memorize the names in Latin?
If you can remember them, it's better. Yeah.
Okay.
I will try to tell you these things in English, but maybe sometimes you have to help me because my English is not very well. And I just try to tell you English words, but with English terms.
Okay.
So the body is here. Here are the transverse processes with transverse foramen. And what we can find here in this foramen? Do you remember? In transverse foramen?
Veins?
Yeah, vein also, but one artery.
I forgot.
How we call, how we name the artery for the vertebra? It's logically, that's why the anatomy is...
Cervic artery?
for the vertebra.
Oh, for the vertebra.
Vertebral artery.
Oh, so it's just vertebral. Okay.
Yeah,
Makes sense.
but just vertebral artery.
Okay.
So here in transverse foramen, we can find the vertebral artery. Here we have superior articular facet for the adjacent vertebra. That's the lateral view. The body, spinous process, inferior articular and superior articular facets. This is transverse process with transverse foramen. And I wanted to show you this one here. The inferior vertebral notch and the superior vertebral notch. Also here, that's the superior vertebral notch, that's the inferior. Here on the thoracic vertebra, what we have here? Spinous process, again vertebral arch with the body, between them is vertebral foramen. But here you thought already that we have superior and inferior articular surfaces for the heads of the rib on the body, and one costal facet on the transverse process for the rib tubercle. Again, spinous process, the body, superior costal facet, inferior costal facet. And that's the fovea costalis for the rib tubercle on the transverse process. Lumbar, body, spinous process, vertebral foramen, transverse processes with the three tubercles. We have costal, accessory here, and mammillary, where we can see them, superior articular, inferior articular, costal, and mammillary processes. So we have articular processes which are superior and inferior, mammillary processes, and costal processes. And here you can see this one here. That's the inferior vertebral notch, for example, of 1, 2, 3, 4, 5, 6. The inferior vertebral notch of TH6 and the superior vertebral notch of TH7, they form foramen intervertebrale. Here, here. You can see also the articular processes here of the lumbar vertebrae. That's the superior articular, for example, of L2. That's the inferior, actually. The inferior articular process of L2. That's the superior of L3, and they are connected. That's the, what is this? How do you think? That's the sacrum, that's the lateral view. So that's an articular surface for the ilium, but it is called...
Where the hips connect?
What?
Where it meets with the hips?
That's the connection with the ilium, yeah? But the name of this surface, do you know? Do you remember? Like an ear, so it's called auricular surface. Auricula means ear.
Okay.
What was that here on the sacrum, on the upper part of the sacrum, which is connected to the L5 here?
I don't remember this part.
We have triangular shape. Each triangle has apex and base, right? So
Yes.
this is the base of the sacrum. Here is the apex. And this is anterior view. So what we can see here, the lines between the bodies, which are called transverse lines, and the openings here, foramina sacralia anterior, anterior sacral foramina. There are 4 pairs. And we have the same on the posterior side, which are called posterior sacral foramina. That's the wings, alausis sacri, left and right. And what else? That's the superior articular processes or surfaces for the L5. We can see them here. That's the articular process from S1 for articulation with the articular process of L5. Here, you can see the difference between C1, C2, and the other cervical vertebrae. But this here is not C7. I told you that the spinous process of C7 is not bifurcated. So on the C1 we have only 2 arches, posterior and anterior, 2 tubercles, anterior and posterior. On the posterior side of the anterior arch or on the inner surface of the anterior arch, we have articular surface for dens axis. We have massa lateralis instead of body, and transverse process with transverse foramen. For C2, we have body, that's the upper view, the superior view. That's the body, which continues upwards to the odontoid process, or in Latin is called dens axis. Here we have superior articular surfaces for C1 again, transverse processes with transverse foramen, and inferior articular facets for C3. And for example, this is C3. We have body, an arch with pedicles and the 2 laminae. Again, transverse processes. And superior and inferior articular facets for the adjacent vertebrae. Next semester, you will see that spinal cord also has segments. And the difference between the cervical vertebrae and cervical segments of the spinal cord is that the cervical vertebrae are 7, while the spinal segments of the spinal cord, the cervical segments of the spinal cord are 8. So you should remember that the cervical vertebrae are 7, from C1 to C7. And What was that here?
That's a part of the C2.
What?
This is from like the C2 from the axis.
Dense axis is this one. Yeah. This
And
one here?
top is the C1.
Yeah, this one here, what is this?
The
Here?
This is part of the arch.
That's the posterior arch, okay. With, on the outer surface of the posterior arch,
the posterior tubercle,
perfect. So this is
just the anterior would be the anterior arch and the anterior
posterior arch with, on the outer surface of it, we have,
the anterior tubercle.
yeah, perfect. This one here and this one, we
With-
have what?
Oh, the transverse process,
Here is the transverse process.
the outside.
So this one should be the massa lateralis, the lateral masses. And lateral masses, yeah.
Okay.
Instead of body, we have two lateral masses, left and right. And here on the superior side, we have one articular facet, one superior facet for the condyles of the occipital bone.
For the skull.
For the skull, yeah.
Oh, okay.
And that's the inferior view. So that's the same inferior articular facet for C2. Again. What is this?
That's for the C2, the spinous.
Yeah, spinous process. Perfect. Here, what is this? You can see small part of it.
Foramen.
Yeah, which foramen?
This is the posterior.
This is transverse foramen.
Transverse. Okay.
That's the transverse process. So this is the transverse foramen.
Oh, this is from the
You
side.
can see transverse process too here on the C1. That's the transverse process. And here is the transverse foramen. Okay. What else? What was that here? On the body, here and here. That's the thoracic vertebra. Here, here, and here. How do you think?
The facets on the sides
Yeah,
for the ribs.
yeah. On the body,
Yeah.
we have two costal facets, one superior and one inferior for the head of the rib. On the transverse process, we have one costal facet for the tubercle of the rib, right?
Yes. The thoracic vertebrae, they're the only ones that have the facets for the ribs.
Yeah.
Okay.
And the lumbar process, the lumbar vertebra are only which have what? These three processes. This one here, how we name that?
I'm not sure.
You can read here. This one and this one. We have two articular processes, one superior and one inferior. Also,
I see.
next next to the superior articular process, we can see the mammillary process. And most laterally, we can see the accessory process.
This is only with the lumbar vertebrae.
Yeah, only on the lumbar vertebrae. Two articular processes, one superior, one inferior, mammillary process, and accessory process. You can read these things here. 3 tubercles can be noticed in a transverse process of a lower lumbar vertebrae, the lateral or costiform process, the mammillary process, and the accessory process. The costiform is lateral, the mammillary is superior, and the accessory is inferior. The mammillary is connected in the lumbar region with the back part of the superior articular process, blah, blah. The accessory process is situated at the back part of the base of the transverse process. You can see here. Accessory process. The back part of the base of the transverse process. Also, here, wait a minute. I saw a picture with all these processes. Superior articular, mammillary, accessory. I want to find costiform, spinous, no, maybe here, no. Costal process, yeah, here, we can see here the costal process. Questions?
Not anymore.
What do you remember for the sacrum? Wait a minute.
With the base at the top,
Okay,
the wings.
okay, on both sides.
Yeah,
Okay,
I remember the coccyx.
okay, the coccyx here, below the sacrum.
Yes.
Here on the,
Transverse sections.
okay, transverse lines, yeah, perfect, on the anterior
And
side.
4
and-
pairs.
4 pairs of openings.
Yeah.
Yeah, on the anterior and on the posterior side. On the posterior side, we have 5 crests. One just on the middle, the sacral, the median sacral crest. On both sides, we have the medial sacral crest. And laterally, we have lateral sacral crest. So one just on the middle, 2 medial crests, and 2 lateral crests. What was that? Here?
The articular process. This is the superior.
And they are connected to what?
The spinal cord.
Not spinal cord.
Oh,
Spinal cord, it's
Yeah,
inside the vertebral canal.
the lumbar vertebrae.
Yeah, which one? Which number?
L5.
L5, yeah. And here, that's the lateral view and the lateral surface of the sacrum.
To the hips.
Looks like an ear. It looks like an ear, so it is called auricula or facies auricularis, or in English, auricular surface. This is actually the articular surface for the sacroiliac joint between the sacrum and the ilium. We have the same surface on the ilium, and they are connected and form sacroiliac joint. That's the auricular surface. What was that here? Here should be the tailbone, right? So this is CO, the first coccygeal vertebra, CO1. And we can see on it these two processes, which are
The
transverse
transverse.
processes. And this on the superior side, we have two horns.
Anterior process?
What?
Are they the anterior processes?
That's the horns.
It doesn't have anterior process?
No.
Okay.
It's rudimentary. So we have only two transverse processes on the first coccygeal vertebra and two horns. And the vertebrae can be from 3 to 5, most often 4. Here are 1, 2, 3, 4. Next time we will continue with bones of the thorax. There are only two bones. We have only not two bones, sorry. We have to talk about the sternum and the ribs. Only this one. Yeah, sternum and the ribs. If you have free time, you can read about the spine. So if you are here in Bulgaria, how do you think, how many weeks you will be online?
The embassy doesn't respond to any emails.
No. Okay, I hope we'll see soon. But the next time we will talk about the thorax. If you want, I can give you this presentation before the colloquium. We will have two colloquiums this semester, one for the bones and one for the joints. I have also a presentation for the joints. And if you want, I can give you them.
Are they not on the
Yeah, sure.
You may use them for the exam.
Oh, okay.
And for the colloquium, of course, but also for the final exam, second year. Ask me something if you have questions.
I think I got a lot of things now.
Okay.
But it will take time to like memorize it all.
Okay, if you have time for the next week, you can read these things. Do you have books?
No.
Okay. So don't worry. Next time we will make a revision.
I did write it down on my notebook.
What?
I wrote it in my notebook, but I don't have any textbooks.
Okay. Okay. Don't worry. I will give you the presentation before the colloquium.
Okay.
So next time we will make a revision of these things and we will continue with the thorax. Okay?
Yeah.
So if you don't have questions, we will see next week.
All right. Thank you very much.
Don't worry.